Good morning, everyone. Thank you for joining me. Allow me to introduce myself. My name is Georgie Gould, and I am a project assistant with Global Community Resourcing. I am pleased to be the moderator for today's webinar, the focus of which is Health Smart Homes User Perspectives. Our webinar today is facilitated by Global Community Resourcing for the Community Care Smart Assisted Technology Collaborative. If you joined us for previous webinars, you'll know that they are designed from feedback and requests we received through the collaborative. The focus of our webinars is to bring together local, national and international perspectives in research and development, as well as deployment of smart assisted technology in the community care sector. Just a reminder that if you haven't formally registered at the collaborative site, it's accessible to all and free to register. Please note that Global Community Resourcing are not promoting or endorsing any particular product, research, identity or organisation. The purpose of our webinar is to serve and to inform viewers of various smart assisted technologies currently in deployment or in development. In this webinar, Professor Anthony Maeder from Flinders University will present on Health Smart Home User Perspectives. Professor Maeder joined Flinders University in April 2016 as Chair in Digital Health Systems from Western Sydney University, where he founded the Telehealth Research and Innovation Laboratory in 2010. He was previously appointed as Research Director of the CSIRO Australian eHealth Research Centre in Brisbane from 2004 to 2018. He is a Fellow of the Institute of Engineers Australia and a Fellow of the Australian Computer Society. He is currently a member of the Standards Australia IT 14 Health Informatics Committee. Professor Maeder was President of the Australasian Telehealth Society in the period 2010 to 2012, and he joined the governing body of the International Society for Telemedicine and eHealth in 2013. In 2015, he was appointed the Fulbright Distinguished Professor in Life Science and Agriculture in Kansas State University. Welcome, Professor Anthony Maeder. Take it away.
Thank you, Georgie. I'll just swap to my slide deck. Well, hello, everyone. I'm going to talk about some work that we've been doing for the last few years at Flinders, and it inevitably rests on work that I'd done previously at Western Sydney University. And the focus of the topic, Health Smart Homes, is something that really doesn't exist completely yet. People are working on it in many different aspects. And the work component that I'm going to talk about here is how to understand about Health Smart Homes from the user perspective. So what's a smart home? The idea is very 20th century. This is a Buckminster Fuller interpretation of a smart home in the 30s. It was a house that was suspended and could move around according to the wind direction and change its windows according to the light and so on. And that's really the essence of the consumer view of a smart home, a home that's got ways of managing, monitoring, controlling how it operates as a home, doors, windows, lighting, music, and so on. A health smart home is a rather different cup of tea. It's not just automation of the health elements of a home. It's also an environment in which information can be passed outside of the home to help support the healthcare and the well-being of the people living in the home. So it's more than just the home that is smart. There's a broader ecosystem that it is involved with that also contributes the smarts. And of course, these could be helpful in many different health settings. People with chronic disease, people who are aging, people who have disabilities could be very proactively supported by a home that is keeping an eye on them and at the same time giving them access to services or making choices on simple elements of service to help them. So here's an illustration that shows the idea. We take a home or living environment or even a work environment, it could be, and we embed sensors. We provide a lot of data gathering information. These could be sensors to do with movement that are placed on the walls. They could be sensors to do with presence of the person. They could be pressure pads on the bed, for example. They could be alerts, maybe the stove is on. And all of that information together gets aggregated to understand what the ambient current situation is in the home setting, so that you can make judgments and predictions about what's happening there for the occupant. So you can imagine that in this ambient sensing environment, we might have a lot of behind-the-scenes smarts just to manage all that data. The second part of the Health Smart Home is this external environment. So some of that data would be transferred to some systems which provide vigilance or systems which provide intervention under certain health conditions. These could be simple monitoring systems that don't intervene, but just aggregate data for clinicians to look at. Or they could be alerts and emergency call systems that bring help to the person if it's needed. So some of the technology behind this suits different parts of that whole picture. If we're monitoring elements of the patient's actual physical condition through perhaps some wearable devices that read vital signs, there would be a section of the Health Smart Home environment that just managed that task and was able to map that to the patient's broader health circumstances. A very important component is also activity or movement, and that's typically done by wearable devices which have embedded sensors, triaxial accelerometers usually, in them, and analyzing all of that very high frequency signal data gives us a way of classifying whether the person's sitting, standing, walking, lying, and so on. At a broader level, we could bring those multiple data sources together and we could begin to make judgments about, is the person in bed asleep and are they sleeping well? Is the person in the kitchen preparing a meal and what are they doing in order to achieve that? Is the person sitting in the lounge and has been sedentary for a long time and perhaps is in need of some stimulation to get them out of that routine? So these sorts of higher level activities of daily living are quite complicated things to deal with. And the work we've been doing is really to blend different pattern analysis methods together to try and achieve an adaptive approach. After all, if a person is going to the bathroom, there could be a number of reasons for that, and some of them could be repeated habitual reasons that are easily recognized. Others could be exceptional reasons that you want to flag as an anomaly. The other part in the Health Smart Home is the ability to communicate with the occupants. And of course, that could be done by conventional telecommunications. But since the home itself is a source of trusted information, one emerging way of thinking about the interaction between a Health Smart Home and its occupant is to use conversational agents which operate as if they're human communicators in terms of the speech, in terms of the appearance, but their decision-making is focused around a particular health task. It may be medication reminder, it may be daily checkup, and so on. So this offers a new, more humanly acceptable and humanly attractive method of Health Smart Homes interacting with their occupants. So we did some scoping work last year about, where are the challenges, what are the unsolved problems in the Health Smart Home area? And they really fall into two domains. The IT system that supports a Health Smart Home, how you're going to build all the pieces and fit them together. What is the architectural model you would use for the IT architecture? What other IT systems would you need to integrate with? How can the IT component offer safer elements of care, for example, vigilance for fallers? The second area is data, and there's a lot of data collected, as I said, and a lot of it has to be processed in quite sophisticated ways. So managing the broad collection of the data is one emerging challenge. Being able to deduce that there are patterns, there are known activities, for example, embedded in the data is another challenge. And then being able to understand for a given person, a given occupant of the smart home, what are their particular patterns and which of those patterns are normal or abnormal is a challenge. Well, I'm not going to talk more about the challenges. I want to focus now on the user perspective aspect that I promised. And we particularly looked at this in the situation of homes that are supporting people to age well. So These homes tend to be very directed towards elements of aging. And so we thought if we had a look at what people have been doing over the last 10 years and what the user aspects, what the user interest or the user engagement in those had been, we could learn more about how to build better smart homes for aging. So within the literature, we've really found that there are 4 dominant areas that are talked about: the functionality in the smart home, the sensor data that's being collected and how the smart home works at an IT level. The services aspects, what are the health purposes, what sort of support is being given, are people being encouraged to improve mobility, are people being dealt with when they're in situations such as incontinence. And the functions that you would choose in order to support one of those health purposes would obviously vary quite widely depending what the service you're trying to provide is. Then there are the benefits, what is achieved, how is the health standing improved, how is the issue that was being addressed by that particular service leading to a satisfactory outcome. And finally, implementing how you build the smart home, how you do the design work, how you bring all these 3 other components together. And that's really where our main research is concentrated, because we want to contribute to better, more comprehensive design approaches. So we did quite a detailed literature review, looked at several thousand papers initially, pruned those down to about 14 that were highly relevant to informing this question of what is the user perspective. So from that, we found that there are really 5 different categories that people who design health smart homes for aging focus on, and therefore users respond to. So the user perception of what they're being given when they're being given a smart home would fall into one of these categories, one or more of these categories, I should say, because many of them provide several. So briefly then, we have smart home elements which look at the physiological measurement, the vital signs, as I mentioned earlier, and are really just monitoring health status. There are smart homes that add to that or aggregate that together to determine more health functional measures. So these might be activity measures, they might be sleep patterns, but they're more concerned with these activities of daily living than just an independent single measurement such as a vital sign. There are smart homes which focus on social interaction, trying to provide elements of, say, verbal interaction, both with the home itself and with people elsewhere, so that the home becomes a portal to some elements of social interaction. There are smart homes focused on safety, so looking, for example, at gait or posture situations and trying to predict whether the person is being less mobile than they ought to be or at risk of falling because they're moving anomalously. And finally, there's the area of cognitive support, where people who are beginning to lose vision or hearing and possibly even lose some elements of cognition can be supported by a smarter environment. And of course, the ultimate hope with this is that perhaps support of people in various stages of dementia might be achieved by a smart environment for them to live in. Now, if we then took an orthogonal view on what the user says about smart homes that provide those sorts of functionality, there is, as you can imagine, a very wide range of user views that's been canvassed and expressed in the literature. But essentially, these are the big ones that are repeated often and which I think are good pointers for designers of smart homes to consider how they will most readily satisfy the user. So there's a lot about how the user feels in using the home, things like acceptability, compatibility with their lifestyle, usability, can they actually do things with the smart home or are they just captive to it? There's another set which are aimed at the future use and the ability to adjust the smart home. So things like adaptability and interactivity, scalability, these are things which determine that the smart home could cope with new needs and new enhancements in the future. And then there are some things which are really metrics, efficiency, quality of life, These are ways that users believe they would rate smart homes so that they would be able to express a preference or influence a design process. So it would take a lot of work now to unpack these further, and we're in the process of doing that. But it's quite interesting to see that some of the user perceptions align with what you might think of as the traditional, perhaps engineering kind of system design issues, like efficiency, like adaptability. And some of them are intensely human. So, obviously measuring quality of life, finding that the system is compatible with their needs, relate to that end of the spectrum. So to sum all this up, I think the things that were really strongly emphasized in the user dialogue is that Health Smart Homes can really provide a good source of motivation and enablement for people who want to live healthily, want to age well and live longer at home. And they therefore provide almost a human influence and an interaction, which is comparable with that you might get from, say, a health coach or a nurse who was looking after their needs. They also empower, they also provide people with tools and capabilities that they wouldn't otherwise have, and they can be leveraged, of course. So if we wanted to bring these things together, we think that we need some sort of framework which tries to explain how these two different areas interact and how we would use that to improve the quality of life of people living in health smart homes. Unfortunately, a lot of the past work on health smart homes has really been done from a technical perspective rather than a user perspective. And it's been a process of let's build one and try it out on people, rather than let's find out what the people's needs are and what they would find to be acceptable, and then let's embed the solutions, the technical solutions in that. So we think there's probably been less attention to the user involvement in the design and implementation cycle than we would have liked to see. And so perhaps the kind of framework we could build, starting from the points I made in the previous slide, could now extend to also cater for user aspects, and we would have a much more widespread and unified framework that could be used both to design smart homes and also to collect the kind of input that is needed to inform that design. So that's a project we have ongoing and probably will finish in the next year or so. And perhaps I'll come back and report to you a little more on it at that point. Thank you very much for listening to my presentation.
Thanks, Anthony, and we look forward to hearing more and about the results of that project. And thank you for your presentation today. If you haven't already done so already, please go online and register for the collaborative. You'll be able to access today's presentation and have the opportunity to ask further questions. Please check the collaborative for more information on upcoming events. If you have any further questions or inquiries, please email us at sat@communityresourcing.com.au. Once again, I'd like to thank the members of the collaborative research team and today's guest speaker, Professor Anthony Maeder. Thank you everyone for attending today's session.